Before we talk about conspiracies, doubts, and all the noise that followed, we need to rewind a little. Because COVID vaccines did not appear out of nowhere. They did not appear into a calm world either. They arrived in the middle of something genuinely unsettling. A new virus, a virus humans had never seen before, which means zero human immunity. That starting point matters. When a virus is new to humans, nobody has had any built in protection. There is no childhood exposure quietly blunting the ages. Every person is in fact a fresh host. That's very different from infections we've lived along for decades. Early on, COVID spread fast. Hospitals filled. Health system watch numbers climbed in real time. Doctors and nurses were learning about the illness while treating it. There was no long manual to follow, only evolving evidence. And in moments like that, the goal is not perfection. It's time, containment, keeping systems from collapsing. One idea that shaped the response, and it still gets misunderstood now, it's population immunity. Not immunity for every individual, not immunity forever, but enough immunity across a population to slow the spread, reduce severe illness, and stop hospitals being overwhelmed. Vaccines were never meant to be magic shields. They were designed to shift probabilities. Fewer people severely ill at once, fewer deaths, fewer health systems breaking under pressure. That's a subtle message. And subtle messages don't travel well in crisis. And just for a moment, let me make vaccines feel less strange. Because the basic idea is actually something nature already does. When you catch a real virus, your immune system learns it. It recognizes, it fights, it remembers it. The problem is, the real thing can make you seriously sick. Some people die, others survive, and the survivors usually carry some level of immunity afterwards because their immune system has been trained by the real thing. So, a vaccine is basically a safer rehearsal, a rehearsal, not the real thing. So, instead of waiting for the real virus to hit you full force, a vaccine shows your immune system a harmless version of the threat, or even just a piece of it, so your body can practice, can rehearse, and build a memory without having you go through the full illness. So when the real virus eventually arrives, your immune system isn't meeting it for the first time. It's quicker, it's well rehearsed, it's smarter, more organized, and the whole point is not that you'll never get infected. The point is that you are very much less likely to get severely unwell. Vaccines were developed quickly during COVID, but not out of thin air though. mRNA, mRNA technology wasn't invented during COVID. It had been studied for years. What COVID changed was the urgency and the scale. Funding arrived, bureaucracy shortened, global collaboration accelerated. Speed can look suspicious when people are used to medicine moving slowly. But speed doesn't automatically mean recklessness. Sometimes it means barriers were removed, not safety steps. Still, for many people, it felt fast, too fast. Now add geography. COVID didn't feel the same everywhere. In Australia, experiences diverge sharply. If you lived in Melbourne and much of Victoria, COVID felt relentless. Long lockdowns, rules changing all the time, isolation, fatigue. Melbourne is often described as one of the most locked down cities in Australia, and for a period, among the most locked down in the Western world. If you lived in Brisbane, like me, or much of other Queensland, the experience was often very different. Fewer lockdowns, more outdoor living, long stretches where things felt almost normal. The same virus, the same country, very different lived realities. Population density matters here too. Respiratory viruses move differently in dense cities compared with more widespread ones. That's not political, that's epidemiology. Masks also became another flashpoint. Many people think masks were invented during COVID. They weren't. During the Spanish flu pandemic more than a century ago, masks were used, and people argued about them too. Some arguments were the same resistance, the same fatigue. They were a population level tool, most helpful in crowded indoor settings, again, more relevant in dense cities. So by the time vaccines arrived, the ground was already uneven. People were tired, trust was stretched, experiences were wildly different depending on where you lived. Messages were sometimes simplified, sometimes oversimplified, sometimes overconfident, and sometimes it was corrected along the way, midstream. This episode isn't about defending every decision that was made during COVID. It's not about pretending mistakes didn't happen. It's about context. Because without understanding the urgency, the pressure, and even the uneven experience of those early years, it's impossible to understand what came next. And what came next wasn't just science, it was stories. In the next episode, we'll look at COVID vaccine conspiracy theories that grew in that environment. Not to mock them, but to see what time itself has done to them, which ideas has quietly disappeared, and why some never really die. They just change shape. See you in the next video.